Yvette Weinstein.
Member Weinstein, can you hear me?
Yes, I can.
Perfect. The meeting will begin shortly.
Okay, thank you.
Thank you.
I'm going to mute. Thanks.
I now call the March 7th, 2024 Senior Citizens Advisory Board meeting to order. Has this meeting been properly noticed and posted in compliance with the Nevada Open Meeting Law?
Yes, it has.
Thank you. Would the Deputy City Clerk call the roll, please?
Chair O'Rear Cameron.
Present.
Vice Chair Weinstein Hall.
Present.
Member Paderetu.
Present.
Member Galati.
Present.
Member Mosdeen.
Present.
Member Drum.
Present.
Member Lee.
Present.
Member Graham. Excused. Thank you, Chair. You have a quorum.
Thank you, Deputy City Clerk. Item number 3, public comment. Comment during this portion of the agenda must be limited to matters on the agenda for action. If you wish to be heard, come forward and give your name for the record. The amount of discussion, as well as the amount of time any single speaker is allowed, may be limited. Do we have any public comment? Seeing and hearing none. Item number 4, for possible action to approve the final minutes by reference of the regular meeting of January 4th, 2024. Do I have a motion or any amendments?
Yvette Weinstein Hall, I move that the minutes for the January 4th, 2004 minutes be approved.
All in favor?
Aye.
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 Any opposed? So moved. Item number 5, report by Gregory Gray, Management Analyst 1, Department of Neighborhood Services, regarding senior issues received by Department of Neighborhood Services, all wards.
Good afternoon, Gregory Gray, Management Analyst, Department of Neighborhood Services. I just have a few items to discuss with you all. We do not have a speaker or presentation today, but our Community Resources Manager, Jocelyn Blewett-Fisher, wanted us to ensure that we are meeting regularly so we can continue to move the work forward for senior services. We have hired a full-time community program technician to run the Care Coordination Senior Services program for the Health and Wellness Division. Her name is Olga Flower. She is currently scheduled to go out to various senior centers, active adult centers, to engage with our senior population. She's currently conducting a survey, which you all have a copy of at your desk. When you have a moment, please take a moment to fill out that survey and give it back to Olga so we can include that as part of our data. At the request of our Community Resources Manager, she is asking that the Senior Advisory Board Chair and members try to coordinate with Olga to join her at your local senior center, active adult center, to engage with the seniors. Our goal is to provide more outreach and listening to our senior community. That way we can better inform care coordination senior services. So as you come back to the Senior Citizens Advisory Board, you'll be making that report to us in regards to how you've been engaging with seniors, what you're hearing in the community, and in the back of the room we'll have what we call a parking lot, which will be a canvas board where we will take what you're reporting to us and putting it on the back on the parking lot, and then per health and wellness, per our manager, we will be giving you quarterly updates on the things that you are bringing to our attention. So I just want to make sure that you're aware of that. I want to take an opportunity to allow Olga to give you a few comments to talk about some of the calls that she's been receiving as part of care coordination.
Hi, good afternoon. My name is Olga Flowers. I am the Community Program Technician, and I work with the Neighborhood Program Services. And some of my phone calls right now, it's been majorly about taxes. Where can they go? They don't have to pay so much because I guess H&R Block was charging them an arm and a leg. So I realized that several agencies are working out of Doolittle, Leeburn, and I believe Centennial Hills. So those have been some of my major phone calls. And others is resources as where can they go for affordable caregivers. That has been a challenging because there's none that their insurance can pay, but nonetheless, we try to find the most affordable ones. So those are some of the phone calls that I've been receiving mostly. Thank you.
And did any of you have questions for Olga before she takes a seat?
Caroline Mosdeen, Ward 6. Olga, would you mind just taking a moment just to give us a brief overview of your of the work that you are doing just in general and the tasks that you have at hand?
Yes. So on my regular day, Mondays, I stayed here mainly just to update all the resources that I've been giving out to seniors, answer phone calls, emails, and that sort of thing. And then go find resources that I can, if needed, I can possibly give out to, upon request. And then on Tuesdays, I'm out at Tuesdays, Wednesdays, and Thursdays, I'm at a senior community centers. I'm engaging with the senior community, answering questions. Right now, I am doing a survey just to see what the major needs are and try to see if I can help them out a little bit. Right now at East Las Vegas Community Center, we encounter that transportation has been an issue. We've been giving out bus passes, some of the incentives for them as, to make it easier for them to get there because they do like the activities that they're having there. So I'm out there in the community trying to help out. I set up a table and help out the seniors as much as I can.
Caroline Mosdeen again, Ward 6. Thank you. Appreciate that information. I don't know about anyone else on the board, but just a quick question about your scheduling. Is that locked in, or is it subject to change if we needed to trade off? I mean, you've got my section and Elizabeth on a Tuesday. Mm-hmm. Other days of the week might be more convenient for me, but that's not to say that we can't do that, but I was just wondering if somebody here wanted to trade off, is that acceptable to your schedule if we were able to get in touch with you?
Member
Yes.
Member Mosdeen, Gregory Gray for the record. I just wanted to clarify that the schedule that we provided to you is basically it's a flexible schedule.
Wonderful.
So if Olga does, so that schedule can be adjusted to whatever your needs are. So if she will be at the centers on those days, but if you need to meet her on a Saturday or something like that, we can definitely coordinate that and put that on her schedule so that way she can meet with the members at the centers. So it's not set in stone.
Yeah, I know that I would certainly like to be there when she is there. see if we can coordinate, because some of these things do overlap with work that we've been working on and with certain seniors. I'll look forward to another day as soon as I can adjust my schedule as well, but I was just wondering if anybody else on the board said, gosh, I can't do a Wednesday, can we switch? Is Olga possibly flexible to switch those days?
So those days will be set because those are the days that we coordinated with the staff for the center.
Oh.
But Olga is also at your service. So basically, she can schedule in addition to the dates that are provided. So we made sure the staff are aware, the centers, that yes, Olga will be there to be a support to the seniors at the centers, but she will also be working with you guys to do social events, stuff like that, so you guys can coordinate with her accordingly, depending on how your schedules are.
Okay, thank you.
Gregory, this is Yvette Weinstein. Can you send me a copy of that list, attach it to an email, please?
I'll do that right
I
now.
don't have it. Thank you.
You're welcome.
Vito Galati, Ward 2. I just have a question. I was wondering whether I could tie in this. Is this connected at all with her program?
Yes, so everyone has a senior services flyer in front of them. That is part of our care coordination program. The phone number at the bottom is to our care coordination line. So any seniors that are facing any troubles or need connection to services and resources can give a call to 702-229-1200. They can leave a message. Usually the response time is within 2 to 3 days business time. They can also schedule a time with Olga to meet with them at a local community center, local senior center, to address any needs that they may have in person.
The other question is, where are these available other than, I would gather, at the senior centers?
Yes, so Olga has dropped those off at all the local senior and community centers that we have visited. We'll be visiting Vets Memorial next week.
What about the libraries?
We have not dropped those off at the libraries.
Yeah.
Would you like us to?
Yes, I would place it on Sahara West.
Okay.
Yes, gladly.
Yes, any libraries within city limits, we will drop those flyers off to.
Sure.
Okay?
Okay, thank you.
Charles Lee, Ward 5. I was at an informational session today at Doolittle about lung cancer, and I met Olga this morning. So just wanted to share that.
Thank you. Yes.
Does anyone have any other questions for Olga? I would like to say it's been a pleasure working with Olga already, and she's just diving right in, and she's definitely there to assist us. So please make sure you reach out to her and utilize her, and at those times that she is at the centers, if you can make it, it would be absolutely fabulous, just so that we can have our board presence there as well. And if you cannot, she's always available to do anything else. So it's wonderful. Thank you. Thank you, Olga.
Thank you.
This is Nicole Graham with Ward 1. Just need Olga, if there's contact information for you? How to get a hold of you? Oh, okay, thank you.
Okay. Item number 6, report by board members regarding senior issues and events within their council wards and at large, all wards. And we have Ward 1, Nicole.
Hello, good afternoon, everyone. Nicole Graham with Ward 1. I think busy month for March is coming up, but quickly to recap from last month, I went to a really great, healthcare summit that was brought on by the Nevada Senior Services. It was based, home-based solutions, enhancing the continuum of care for persons with dementia, improving health outcomes, and reducing caregiver burden. But the focus this year was the health-related social needs. How do we get in front of the wave, prevent the hospitalization, the loneliness, and access to basic home needs, emergency basis, and as well as the housing crisis. So really, it was a really great, informative seminar that I went to. It was an all-day event over at Suncoast. Great resources that came back to me that I forgot that was available for us, for our senior population. So connected with some of them. Hopefully we can have them come in for speaking. So I sent those over to Gregory, connecting them. Some great resources I feel that are coming. a PACE consultant, which is based out of the Medicare guidelines. It's an inclusive all care for elderly, which is really great, interesting. Hopefully that comes for us. Also some great resources through the Nevada Senior Services, the Hospital to Home, the COPE, Home Meds, and just some more community education. Again, some great resources. And then a new one I don't think we've really have known too much about, but the new with the School of Medicine, the Health and Aging Network, MinSun, some great free virtual kind of seminars and education telehealth for our seniors. So hopefully we can connect those with our senior centers, trying to connect more with her and what that may look like for our population. So really great, so hopefully more of that will be coming. Wanted to share some things I'm sure others will know. The Federal Order of Eagles, the National Veterans War Day is coming up on the 29th. We also have this month with Councilman Knutson. We are doing, he's coming to my community, but we're doing I think there's a way to bridge youth mental health as well as senior. That's kind of mental health and building that correlation. It's definitely going to be proactive, setting that stage, us talking more about that for the youth and senior population. I think the more we can bridge some of those, I think it will just help from our younger generation to our senior generation. So looking forward to that event coming up on the 11th with him. Also on the end of the month, we have Charleston Heights with their resident council. So meeting with them on resident council and setting their board status. So looking forward to that. Thank you.
Thank you. And on that PACE consulting, is that the PACE program? Oh, good, because it was passed and it has been tasked to us at the Policy and Legislative Subcommittee with the state to start to visit that and see what we can do with it. So I'm glad to see that there's support for that everywhere.
Correct. I think the biggest was it was approved in 2009, which is what I was told, but it's been waiting on funding.
Yes.
So I think the more we can talk about it, the more we can bring that awareness to our community, will just kind of help to bring that bridge and hopefully.
Yes.
So.
And the good news is we are working on it.
Yes.
Yay. Thank you. And Ward 2, we have Vito.
Yes. I attended the monthly breakfast buzz with the councilwoman. It's always a pleasure to be there because, again, as issues come up, at least we usually don't discuss as far as direct issues that I find, but concerns within the community. And most of the attendees are seniors, and the usual concerns are safety and homeless appearance in the area. And usually the answers, we get quick answers because we have a representative from the police department and also from the city marshal. So it covers all areas. I have to say for the past 5 years that I've attended these meetings, I always come back with having answers, and I'm glad that we do have it and hopefully continue to do so. I also visited from time to time the local library to see exactly what's there, what's available in reference to senior citizens, and I did find some interesting programs that are present right now. One is the Senior Peer Counseling, sponsored by Dignity Health, a workshop, and it's free. Another one was the Senior Scam presentation. They also have a yoga on Sundays. And also, which it was present at the time when I did see it in action, was the income tax, was a free income tax preparation assistance to residents 18 years of age and over. And entirely free, you just had to make an appointment for it, which I thought it was wonderful. Then my last one is usually, it came upon me as I was taking my daily walks, that I noticed there was a senior on riding one of those, the mobility vehicles, And I just followed us, and she was ahead of me on the sidewalk, and then all of a sudden, in the middle of the block, she decides to cross it over on the other side. It's not a main street, but definitely it's supposed to be 35 maximum speed, but I've seen 55 and 60 there. And then I realized, I said, you know what, among other things, actually, it's a sitting duck because there were no lights, nothing on that. It's during the day still, but you want something if something like that does happen. Granted, she was breaking the law by crossing in the middle of the street and going over, but my question was, does this vehicle have anything, any sort of lights if they go? And I continued to walk, and turned out to be that she traveled at least a couple miles. Well, then I kept on walking, and about 20 minutes later, I see this, I thought was the same one, turned out to be someone else, and was going the same direction I was going, and I was able to, at one point, stop because she had to cross Fort Apache, which is a major, 3 lanes on each side. The speed limit, I believe, is 45, but officially 45, but I think it's 65, and sometimes God knows how fast. And I asked, I said, excuse me, where are you going? And again, she was traveling a couple miles to go to the the supermarket. Now, 2 of them, and the other one had gone to the supermarket because she had groceries on her basket. And I asked her, says, do you realize that when you go there, do you ride on the sidewalk or on the bicycle path? Because there are bicycle paths there on. And she says, usually on the sidewalk, but sometimes I have trouble doing that. And even she had some words with the school crossing guard because she was going too slowly, or her unit had stopped in the middle of the crossing. I said, well, that's why you need something of the sort. And it came upon me to say, well, what are the safety guidelines in Las Vegas? And sure enough, as hard as I tried to find, there weren't any. And obviously, most seniors will default to buying something inexpensive, which they run about $500. I did go to one of the companies, and these lights, additional lights, are optional. So obviously the seniors are not going to get them if they're optional. I feel that they should be standardized and should be part of it. So I approached the councilwoman, and we're working on that. Hopefully we can do something about it. I just hate to wait until something happens. And I know I'm sharing this because some of the communities have seniors, and quite a few use them. And, you know, we all say, well, in good judgment, we're going to be safe, but you never know. Accidents happen because the exception happens. And so I think will be a good cause to exactly force the companies to put these. They're very inexpensive. And we're talking about a $10 investment to save a life. I think is worth it. Thank you.
Chair O'Rear Cameron, is this something that possibly we could bring up to Department of Public Works and see? I'm thinking maybe because they were just at our event, and see if we do have anything in place. I don't know. But obviously now things are going to be going on the board, and we're going to be following up with it. So that's definitely one to follow up with, since we don't seem to have anything that you can find.
Yes, I know Dave was here, and he knows about it,
Yes.
and he was going to check into it, but I just want to share it. I think
Yes.
if we all show our concern there, maybe something will be done. It's very easy to do, inexpensive, and I think it's
Yes.
worth it.
Wonderful. Well, now we have it on the record, and we can all kind of pay attention in our own words on that one, too. That is a major safety situation there, and I agree. I see it in my ward as well. Thank you. And Ward 2, we also have Yvette.
Yes, and at large member. The city of Las Vegas took a symbolic stand against anti-Semitism, which was great. I have seen anti-Semitic slurs on 2 temples in Ward 2. That would be Temple Beth Shalom, and I went and they had an event trying to paint over that. as well as Temple Sinai. So that was something that I think is possible. And if you see any of that kind of horrific destruction, please report it to your ward and to the police. I think that's very important. Also, the city of Las Vegas voted to buy an animal foundation building. And I'm bringing this up is because I think adoptions by seniors, if they're able to have pets, would be a very good thing. Pets visit senior citizen centers, and also having a pet is a very soothing thing, gives some dignity to a senior because they are taking care of somebody other than themselves. So that's just one of the things that I volunteer, and I do go down to adoptions once a month. Ward 2 is going to have allow people to shred, and I think that's going to be that'll be at Veterans Memorial, and that should be in April sometime. So you can take some of your medicine and you can take some of your papers as well. I attended something that was held in my ward about the child trafficking. And again, that's a very serious problem in our community. Trafficking is something that is rampant here, although it's a dirty little secret that we don't talk a lot about. So I did attend that. And there is going to be an Easter hunt with Canine Carnival on March 17th at the Bruce Trent Park in our ward. That's 8851 Vegas Drive. That's an awful lot of fun for kids and seniors to participate in, bring your grandchildren, etc., and try to find an egg for yourself and maybe adopt a pet. There's also going to be another human trafficking prevention event at 1305 West Horizon Ridge Parkway, Hope Church, March 18th at 5:30, and I think that would be a good thing for people to attend. The next breakfast with the council person in Ward 2 is April 6th from 9 to 10 at Veterans Memorial Community Center. As Vito always goes, I attend infrequently, but it's a way for seniors to participate. You meet your neighbors, and you can find out what's really troubling people in your particular wards. I know all of the wards have those things with their council person. And that shredding and medication disposal will be on Saturday, April 6th from 10 a.m. to noon. Anybody can come. And again, that's at the Pavilion Center pool. There'll be art in the park. We have a very busy ward, and the council person really gets involved, and she attends all these things. So Art in the Park, again, will be at Bruce Trent Park, April 20th from 10 to 4. That's a great event. I've gone many times. I bought some art, and I've talked to seniors there and my neighbors, and it's a lot of fun. So that's all I have today. Thank you.
Thank you, Yvette. And Ward 3, we have Jennifer.
Hi, Jennifer Drum, Ward 3. Wanted to let you know that I missed the January meeting, but in December was our senior luncheon with Councilwoman Diaz at the East Las Vegas Community Center. That was well attended and went very well. We've been going around the ward and meeting with seniors with some pop-up visits, bringing them calendars and donuts from Pink Box as well as Krispy Kreme. So those visits have been going well throughout the ward. Also been attending the first Tuesdays in our downtown area command. We will be having a new police commander in there taking charge. The middle of this month, we're losing our current one. But the main concern is safety, and in the downtown area command, our numbers are looking better. So the officers have been trying to keep us all safe, and that's, I know, a concern for everybody, but especially for our seniors. That's the wrap up for Ward 3. Thank you.
Thank you. And Ward 4 is myself, Chair O'Rear Cameron. And for my report, I've itemized the things that I've heard the most since our last meeting and just throughout the times that I'm working with seniors. So the first is the housing and utilities. Continual increases in rents and large increases in utilities are making it more difficult than ever to get ahead of the housing crisis or even just hold steady. When we talk about utilities, it's not just the recent Southwest gas increases, it also encompasses things like apartment complexes that have been charging utilities ever since the pandemic. There are no meters, and they are using a square footage and how many people are in the apartment with a rate determined on the lease addendum. And that should constitute a fixed rate, yet it's changing monthly for many people. It is not understood how this can occur when there are no meters and people have different lifestyles that should consider how long they are away from the residence, how much of the water they're using, the trash, the sewer, etc. And when you're renting a home, sewer and trash are often covered in the price of the rent because those are the ones that can become a lien if they're not paid. So it just seems a little odd that apartments are now charging this when it's already always been a part of their overhead. And then that, along with the increased rents and the increased equity that they've obviously been getting with the way the state of everything has been with properties increasing, property value, excuse me. So it's also helping to become kind of a part of the burden on the people with the housing challenges because now it's being passed through to them, which I find kind of interesting. And it seems like there's just no oversight in this area at all. And it continues to escalate. They continue to add on fees with this interesting name that you don't even know what it is. And when you ask, they have some interesting term that nobody really can fight. You just have to pay it. Many of them aren't even allowing for partial payments with that extra fees that people will just get and not realize they're getting them. So it's really, really a problem, and it's affecting our housing challenges a lot more. And then also adding to the financial and housing and utility challenges, this has been brought to my attention by quite a few older adults recently, that many of the credit cards and finance companies, et cetera, are charging fees if you want to continue to get paper statements. And of course, they're used to paper. They're not used to being online. So of course, this is going to mostly affect the older adults. Because they are not as acclimated to doing everything digital online, and oftentimes they don't feel comfortable because of the amount of scams and security concerns that we're always telling them about online. So we have an interesting situation there that's also going to add to the financial and housing. Isolation. This was a challenge long before the pandemic, and it has significantly increased after because of, the mind being told to stay at home and all the warnings, et cetera. Many of the older adults are isolating themselves, but yet they need services and they need to know about them. Reaching them has proved very difficult because they are not the ones that are coming to our senior centers or even to the activities in their own clubhouses, and that's where the information would be readily available. I believe reaching them is a big priority for us, and finding ways to do so should be at the top of our list. Sun City Summerlin, which is a part of our Ward 4, is looking at addressing this, and I'm happy to be collaborating with these wonderful ladies that have joined us here today so that we can see ways to get them the much needed help that are isolating themselves, and they are really on top of it. I really got to give you kudos to what you're doing up there in Sun City Summerlin. And then cognitive challenges. It's been really interesting how many calls I'm getting for cognitive challenges. There's been such an increase, and I'm learning these through the touch points at all the resource fairs, that they believe that some people that, whether it's family members or friends, may have a cognitive decline. So the first thing I do is I ask how have they seen a doctor concerning this? And are they keeping notes on what they're seeing? Because keeping notes would be very helpful so that way you don't forget the different things when, you're around that person, whether it be family or friend. And it will help them as they move forward so they can see how to assist. There's a lot of wonderful resources in our community for Alzheimer's and other cognitive issues. And 3 of the touch points were of a combative nature that makes caregiving a real struggle. And there's so many things that happens when cognitive comes into play, too much to list here. And there's a lot of resources, once again, but we need to have them, look at getting a diagnosis, right, for the cause, because cognitive can come in many forms. And there are resources that are for the affected person and also for the caregiver. So I want to make sure that we have that on record for anyone that might listen to this or anyone you might come across. And our appointee for Ward 1, Nicole, I know is extremely familiar with this. So always feel free to reach out to her because she has an awful lot of information on that. Security and safety concerns. I'm repeatedly told of the crime, and also I see so many posts on our Next Door Neighborhood app. I mean, it is mind-blowing how many posts of, someone coming into their backyard, looking in, their back doors, just casing out areas. I mean, it's endless, casing out their cars, knocking on doors and acting like they need help or something, but then trying to look in the door when they do it, which, by the way, don't open your door. So it's been really interesting, the things that I'm seeing. For me personally in Ward 4, it's been a homeless gal in our apartments that was actually arrested for trespassing because my husband and I helped with our cameras so that they could see that she actually came over the wall where she always does, right by our apartment. And the problem is then she ends up back on the streets. And she throws rocks. We've seen her with weapons on her. And she's very, very loud. You can tell there's mental health involved. So I know this is something that's being addressed, but I did want to get it on the record because it's affecting myself too in my own ward. And it's, I just wish she could get the help, but I know if they refuse it, this is what happens. So I just want to make everybody aware that, they are doing their part because I follow up with Metro, after she's been arrested and everything. But then when she goes into the system, unfortunately, they have boxes they check, and if she can be, released, she will. And it's up to her to get the services. She stayed away from the area for about a mile. I found out her mom lives in our ward, so that's probably why this is happening. So I do my best to just work with that situation on how can we better help them, because it's a situation that's happened to them, and they are not in the mental capacity to just easily bring themselves out. Veterans, I have been getting, again, a continued consensus that many available benefits are not known to the veterans and their spouses. I connected with an older adult who was able, after some time, to find relief for when her veteran husband passed away, and she's been involved in legislation to make changes to get the information out through doctor's offices, where there might be a larger touch point, which is interesting because that gives us ideas on places we might be able to look at getting information out, since they may not be, at senior centers, whatever have you. It's actually something I've always heard regularly during my advocacy for a couple decades. And after a lengthy discussion with her, she actually helped me realize that many of the benefits that she was speaking of can actually relieve a lot of our housing challenges as well, because it helps them with housing, and some of them actually have ways that they can get another house too with their veterans financing and rent it out to another older adult within their own communities. So I thought that was really interesting, and I'm going to continue to connect with her for ideas moving forward that we can bring. I have attended a lot of resource fairs, including Sun City Summerlin's resource fair that was absolutely amazing. A lot of great information. And then I've put on some of my own at communities like I always do, and I hear all of these things that I just said continually. So that tells me that those are some priorities. Also attended the first Tuesday, and we just had that actually this Tuesday, and Sun City Summerlin with Councilwoman Ellen Polinsky and the staff. And there was Code Enforcement and Public Works who spoke, and with their information and the questions from everyone, I learned a lot of new and valuable things. So I highly recommend all of us on the board, as well as everyone who may be hearing this, to get to those. And you can get your questions answered. That's the best part. And so now I'm going to share the upcoming events. We have the first Tuesday on April 2nd in the evening at the Northwest Area Command on Cheyenne. That will be coming out. You'll be able to see that on our Ward 4 website here shortly. And because Ward 4 actually encompasses the Northwest Command and the Summerlin Command, we rotate between both. And then there's also a document shredding that's going to take place at Desert Shores Community Center on Saturday, April 13th from 10 a.m. to noon. And there's a limit of 5 boxes or bundles per car. And the volunteers are going to unload your car, so you won't have to worry about that. And the shredding services go until the capacity is reached. This is very important with identity theft, so if you do have that, especially during tax time, it's a great service to utilize. And that's on 2500 Regatta Drive in their parking lot. And then we also have a neighborhood meeting for the Summerlin Parkway Trail Project on Wednesday, March 6th, 4:30 to 6:30, and that's actually going to be at the Veterans Memorial Community Center, which is in Ward 2, but because, once again, we have a lot of crossover, we want to make sure you all know about that. And that is it for my Ward 4 report, and now we have Ward 5, Charles.
Hi, Charles Lee, Ward 5. The two things that I have, so I emailed Gregory about restriping issues, and I was just waiting for him to get back with me to let me know, how far that has gone. And the other thing, at the Doolittle Center, they ran into some barriers with the entrance, so they wanted me to, bring that on to see is there anything that can be done about that.
Gregory, for the record. So yes. So initially, when Member Lee brought up the concerns about the entryway to the Doolittle Active Adult Center, the request was that the doorway be changed to be front-facing, as the door is on the side of the building. So there was initial approval for federal funding to change the entryway. And when we got together with the Parks and Maintenance engineer, and we were able to get a designer hired to take a look at the building, the federal requirements were not met. So there was not a ADA concern, and the safety concerns that were brought to our attention did not align with the federal guidelines to use federal funding. The total cost to change the doorway was about close to $1 million, $1.5 million to change the building itself due to the way that the doorway was built on the building itself. And it did not align with the priorities for Parks and Recreation in regards to their master plan for the center itself. So they did not have any priority to budgetize changing the doorway. So unfortunately, because of the strict federal guidelines regarding the use of the monies that were proposed to change the entryway, the project was denied. So I just wanted to provide some clarity on that situation. The only way to really change, because it is considered a cosmetic aesthetic change to the building, the money would have to be raised or allocated as a priority to Parks and Recreation's budget, and that is at a directorial level. We don't have any influence on that.
Thank you for the clarity on that. I was wondering what was happening with that. And now you said it was being changed to the front-facing, and that is the only option to address the challenge that Charles has been bringing up, is to get it front-facing, or are there any other options by any chance?
Unfortunately, there is not, because the doorway is not an obstruction. It does not prevent, it is ADA compliant. It is not, it's not desired just the way it is, because it is an L-shaped entrance. There are some concerns by staff about safety, but there hasn't been any reports of any safety violations to the staff or to the seniors entering and out of the building. It's just very inconvenient, and unfortunately it just does not, we utilize a lot of federal dollars to complete a lot of projects, and we weren't able to align it with the guidelines to use the money. So the only other option would be a general fund, and that requires director approval from Parks and Recreation. So unfortunately, that's something that will have to be discussed with the director with Parks and Rec.
Thank you for that clarity. Charles, do you have anything else?
No, that's it.
Thank you. And Ward 6, we have Caroline.
Thank you. Caroline Mosdine, Ward 6. First of all, I'd like to thank the chairwoman for her thorough review of the issues. That was excellent, and instead of reiterating any of those, let me just say they are valid for all of our wards. This is a citywide problem, and everything that she brought up was excellent. The one thing I'd like to reiterate, though, is something that I bring up all the time, is food insufficiency. The more people I run into, and the more I find that this is becoming, or continuing to become, a greater and greater issue. I've been meeting with people, not necessarily at our senior center, but on walks through Floyd Lamb Park. With the weather getting nicer, we're finding more people are out there, and they're saying, well, you know, I'm getting exercise, and I feel that's good for my body, but I'm not getting the food that I need. I think one of the things that I'll be discussing with Olya is really finding ways that we can get additional meals or mealtime out in the wards, not just in the city center. So I look forward to working with you on that. Also, following up on Yvette, she had some very good points as well, as everybody has, but I would also like to mention two things. One, on the shredding and medications, which are coming up around, I would ask that when those are being set up, if occasionally we can have the electronics added to that. I was at one a few years ago, which was held by the county, and when electronics, and I believe it was the blind who take these units apart, but in most of the other shredding and med events, that's not anything that's added. So if we can find a way periodically to have electronics added to shredding events, I think that would be helpful. Also for Yvette, adoptions, I'm a strong advocate of adoptions. As far as these pet adoptions, I have a pet right now who I not only adopted but has been in training for scent work, which is a follow-up of something that I had before COVID had been working for the airport. Basically, she finds, in her training, she finds clove, anise, and birch, but we've added gunpowder to that, and the whole idea is basically that we would have some additional volunteers to be able to assist DEA. So perhaps one of these days that will get back on track, we'll see. But in the meantime, I'd also like to mention at Floyd Lamb Park, bunny adoptions. I think I might have mentioned it once a couple months ago, but we did have someone come in and speak about seniors. Bunnies could be excellent companions for seniors. They're easier to care for. And I don't want to go into the details, but I can tell you, go over to Floyd Lamb Park, ask about bunny adoptions. You'll be surprised at how much help you get and how much equipment you get with an adoption, and they're surprisingly less care than I anticipated. So I haven't got one. Or actually, they come in pairs. Actually, they say they don't adopt one at a time, but nonetheless, it does look like a very good program, as well as other pet adoptions. Looking backwards, we had a Love for All pickleball event held in February at the Durango Hills in conjunction with Ward 4, and that was an excellent event. Unfortunately, there was a little bit of a problem with one of the husband of our councilwoman for Ward 4, who had a problem with his leg. I guess he ran a little too fast. He was into the competition a little bit much, but he's doing well from last I've heard. So anybody wanting to follow up and wish him a good recovery, I'm sure they would appreciate that. The taxes, regarding tax assistance, this is something we spoke about for a couple months and tried to get a better handle on appointments over at the in Centennial. I've been trying to assist with that a little bit. It is going smoother than anticipated. I still think next year we're going to have to do a little better job again, but I'm not getting as many complaints as I had thought we were going to. So that's a good sign that appointments are being made and are being met. And the folks over at the desk are assisting as best as they can. Now, there's also a new program over there, and we have been asked to try to see if we can have it extended. It's on the second and fourth Thursday of the month, where there's some assistance with computer technology, and some of the basics are there. At this point, it's just questions being answered, but these folks are actually looking for a little bit more, even some basics, so we'll have to see if we can find a way to expand that and get some additional training, kind of more like classes as opposed to question answering on that. I'd like to remind people that the Floyd Lamb Park Farmers Market, now that the weather is getting better, they might want to be out and support some of our local growers. It's on the second and fourth Sundays of every month from 9 to 2, and that's at Floyd Lamb. Again, it's the farmers market. The Bocaditos with Bruni, which is our meeting with our councilwoman, held at the YMCA at Centennial. The next one is going to be next Thursday, a week from today, and that's from 9 to 11. She's had to shorten up her hours there because of other needs in her city position. So please try to understand that she can't spend as much time there as she would like to, but nonetheless, you can leave messages, or you can certainly be in touch with me. I'm there usually on Thursdays and hopefully now on Tuesdays, and it appears that he's going to be there on Tuesdays. We might be able to work that out. Ward 6 is also trying to work out a senior field trip, and they have a schedule, a survey rather, for the places that seniors might like to go. It's a one-day trip. It's going to be to either Death Valley, Valley of Fire, Spring Mountain Ranch, or Tonopah. So if you have any ideas, we're going to have a busload of folks going to be joining us for one of those trips, but if you have an idea which one you'd like, get your vote in on that over at the YMCA. There's going to be a Animaniacs, if I said that right, in concert, which is at the Centennial Amphitheater, open for everyone free of charge on March 16th, coming up at 7 p.m. And let's see what else we have there. There's lots of egg decorating and egg hunts, so I'm not going to go into all of them. I do want everybody to know that they should find these on the newsletters from all of their city council and councilpersons' websites, or please, once again, try to remember to request the emails for their newsletters. There's lots of email information on all of them, and by all means, ask for all of them, because you can join in other wards. There's no reason that you shouldn't, should think that you can't. By all means, do that. But there is one in particular that I'd like to mention, which is at the Whitney Senior Center. This is a Clark County event. It's at the Whitney Senior Center. It's for ages 55 and up. It's from 11 a.m. to noon, and it's painting some Easter eggs. So it's going to be specifically for seniors. And then something more generic or more broader in terms of what's going to be held is for Clark County, once again, at the West Flamingo Senior Center on March 13th at 9 a.m. The commissioner is going to be bringing representatives of all departments and all agencies for a coffee and conversation. So if you have things that are more broadly needed outside, the specific city limits, by all means, that's a great place to go and get some answers from the county. So I hope that people can take advantage of that. And just as I turned my page, I went back to what we did before. Southwest Gas came to the Senior Center on Monday the 12th to discuss some issues and share information. It was very well attended. People were very upset about the increases, no doubt about that, but there was some explanation about them, why and how, and just as a reminder to people, there is a no charge program for Southwest Gas to come out and evaluate what's going on at your house. There may be ways that you can save that you're not even aware of. So by all means, take a look at Southwest Gas's website, and they'll have information on that. And we also had representatives from Fire and Metro who came and gave some information about fire rescue and Metro safety and things of that sort. So you'll probably be seeing similar events at your within the other wards. Thank you very much.
Thank you. And I did want to point out for you that Olga and I have actually been in touch with some of them on the hunger services, and they are one of our speakers next month. So you'll be happy to know that.
Vito Galati just wants to make a comment on the pets that for seniors. And as you were mentioning that, my concern is that seniors cannot afford, unfortunately, because of the vet fees are prohibitive. And I was just wondering, it is an excellent proposition to make that seniors should have pets for companionship and so forth. Do you know any programs that are sponsored that will cover the fees?
Chair O'Rear Cameron, yes, they do actually have a nonprofit here in town that helps seniors with food and various things. I will get their name and information so that we can get that on the record.
Thank you.
And Caroline Mosdeen, Ward 6. Vito, also as a follow-up to that, I know more from New York, but I believe out here we're going to try to be finding more veterinarians and veterinarian services that will provide reduced rates for medical care. Now, one of the things is that we've been bringing up over the past few months is about the chips. Everybody has to have a chip. Everybody, every dog, every cat, every pet has to have a chip to get them home safely if they get separated from their family. There's no charge for that. And there are other free or low-cost spay and neuter clinics, although a lot of most adoptions come with spay, which is part of the reason why there is a fee in most cases. But there are also for the injections, for the necessary health screenings and injections, there are lower cost programs. So yes, we can get you some more information on that.
Is there a listing of these providers that will offer free services?
I don't believe that there is an official listing. Let me take a look at that, and let me see what I can get back to you with on that.
Thank you.
Thank you. And Ward 6, we have Elizabeth.
Elizabeth Pettilator here from Ward 6. As usual, Caroline told everything what I wanted to say. I back up with that. And yeah, the Southwest Gas information was very, very useful for including me. The one thing I attended beside those information was the human trafficking, mainly focused on children, child trafficking by the city, and the town hall meeting was held in Ward 6. Followed that, there was a faith-based event at the church, which I also attended. There was collaboration with the county, Metro, FBI, and school district, and there is a big collaboration happening, and I am involved in that too. That is a very good service what we are offering to our new generation, and the education was given to the parents how to protect their children in that. One additional thing, I haven't scheduled a meeting yet, but I had the pleasure of meeting with the Councilwoman Victoria Seaman. I have some concern with the Indian senior citizens. They are not exposed themselves to anything, and they wanted to hide in their own whatever, but I'm trying to get them out from there, and possibly I will be meeting with them for the Clark County meeting on the March 13th at the Flamingo Library. I'm going to ask for some of the representatives to meet with us there. They can go forward. They're claiming, and most of them came from other states. They said they had better senior services, especially aging and their recreation and all those things. They wanted to know what is available there. So possibly that may be one. And I did talk to Victoria, Councilwoman Victoria Seaman, and she is also interested in personally meeting these people and come with a plan. So that's all I have right now. Thank you so much. Have a wonderful month.
Thank you. Item number 7, discussion for possible action regarding next steps and future meeting topics of the Senior Citizens Advisory Board, all words. Do we have any new topics or next steps that anyone would like to address?
Madam Chair, I just want to take an opportunity to address some of the things that were discussed at today's meeting, just to make sure everyone is aware of some of the topics that have come up already. Just great for the record. Digital divide, seniors and technology. I know that Member Weinstein Hall has brought up seniors and youth for mentoring, isolation among seniors, security and safety concerns among seniors, caregiving and PCAs, homelessness concerns, consent awareness seems to be a commonality that's been coming up in the meeting, so I think that maybe having some discussions about that may be helpful. There have been some concerns around estate planning and trusts. I think it would be relevant to have someone provide some clarity on that. And senior hunger, food and nutrition, as well as senior pets and pet care.
Thank you for that wrap-up. We have a full plate. I think that covered everything we've been discussing through the meeting. Does anyone have anything else? I know we've been having quite a list in our last few meetings, and we can always bring them up at the next meeting if you do not.
Carolyn Mosdeen, Ward 6. I just have a question, and perhaps either Chairwoman or Gregory can answer this, as to where this should be directed to. I've had some comments from 2 different people, not a crowd or anything like that, but about the condition of the YMCA locker room and showers. They've brought these issues to the attention of the people at the desk, and this is going on for a couple months. And also, I guess, I want to say young boys, they're not necessarily young boys, but boys in the female locker room. So there's a lot of little things going on at the YMCA, and I was just wondering, can you tell me where we might direct those questions to?
We can get together to discuss that further. We may be able to talk to Parks and Rec about it, but I know that YMCA is their own entity, so it may just be a matter of bringing it up with their superiors as well. So we can definitely look into that.
Thank you. Item number 8, citizens' participation. Public comment during this portion of the agenda must be limited to matters within the jurisdiction of the board. No subject may be acted upon by the board unless that subject is on the agenda and is scheduled for action. If you wish to be heard, come forward and give your name for the record. The amount of discussion on any single subject, as well as the amount of time any single speaker is allowed, may be limited. Do we have any citizens' participation today? Seeing and hearing none, our next Senior Citizens Advisory Board meeting will be on April 4th, Thursday, the first Thursday always, of 2024 at 1 p.m. right here in Council Chambers. We are now adjourned. Thank you.